Welcome to Torchlight's Exceptional Parenting Podcast, where we talk with the nation's top experts about today's toughest parenting challenges. Whether you're concerned about your child's development, learning, behavior, or you just want to make family time more enjoyable, we share the practical solutions and tools that can help.
Hello, everyone. Welcome to an all-new episode of Torchlight's Exceptional Parenting Podcast. I'm your host, Stefanie Boucher, and today we are going to be talking about something that I know is an area of concern for many parents in the Torchlight community, specifically if you're parenting a child who is on the autism spectrum, and that is how to address behavior challenges. You know, in our organization, we get a lot of questions related to behavior or emotional regulation in children with ASD. So we're going to dissect that topic a bit and discuss what is typically at the root of behavior, what the function of behavior is, how to improve communication with your child as a key component in supporting positive behavior. And of course, we'll offer some practical strategies that you can use with your child in daily life. I am here today with Beth Kadlec. Beth is an occupational therapist and the program director at the Center for Autism and Neurodevelopmental Disorders, otherwise known as CAN-DO, at the University of Massachusetts Memorial Medical Center and the Eunice Kennedy Shriver Center. She is also an assistant professor in the Department of Pediatrics and Psychiatry at UMass Medical School and an instructor for the LEND program at the Shriver Center and a lecturer for the Department of Occupational Therapy at Massachusetts General Hospital Institute for Health Professions. That's a lot of creds, Beth. She has 36 years of occupational therapy experience, and she has devoted her career to helping caregivers and providers develop more effective ways to support children at home, in school, and in the community. Welcome, Beth. I'm so thrilled to have you on the show.
Thank you. It's an honor, and I look forward to our conversation.
Well, it's an honor for me as well. CAN-DO, or the Center for Autism and Neurodevelopmental Disorders at UMass, is an outpatient clinic that provides some really cutting-edge services to children with autism and their families. You work with both young adults and youth with emotional and behavioral challenges and complex presentations of ASD. And in that vast array of experience, I would be really curious to start out this conversation by finding out from you, what is the most common reason or set of reasons that families are referred to you? What are some of the more frequent family concerns or types of scenarios that you see there?
So we see children and young adults who are really struggling around regulating their emotional state. And what I mean is that it can be any range of emotion and different kinds of emotions. So the more obvious ones are where a child is either hurting other people or hurting themselves in different ways and using behavior to express their extreme internal state. And so we see them to help evaluate and make recommendations for treatment. And the other type is there are children who keep their emotions inside. And that's a different profile, but those children, we'll see those children as well because they're at risk for, and are in need of help.
Yeah. And, without getting too medical, because I know a lot of us listening we don't have medical backgrounds, what are the factors that are kind of at the root cause of this emotional and behavior dysregulation? I mean, of course, all behavior is communication. Behavior always contains a message or information about the way the child or any person is experiencing the world around her. What perspectives might parents and caregivers frequently want to tune into when it comes to their child's behavior?
Well, we have a list of things that we look at that we have seen as common patterns that affect a person's ability to regulate. And the first one is, if we're going to focus on the diagnosis of autism, by definition, the diagnosis of autism is a social communication disorder. So these youth and young adults are struggling with how they understand and how they navigate a relationship with another human being. And because they have a hard time comprehending what's happening socially, and they also may be having a hard time comprehending expectations for even participating in daily activities, they have a hard time then producing an output and a response, either using their words or some other communication device. So what happens is that they really get confused about what do these people in this world want me to do, and they react in more of a behavioral way, or they might be verbal as well, but they get dysregulated because they're often really confused about the expectations and not understanding the social world. That's one. The other is that we see commonly is that what we use is this term developmental level. So that often the way that adults are interacting with children or even young adults is not necessarily at that person's developmental level. So it means we often are talking above their level. So they don't understand just by virtue of the language is not at a level they can understand. And we see this is pretty common, even with kids who are really verbal, that you think they understand what you're saying, but they don't. And so this is what we do is we evaluate and we say, okay, this youth, some of their skills might be at their age, but other, especially around language comprehension, are much younger. And so how do we adjust what we say, how we say it, and in a way that is really matching them at their level? And when we do that, we see significant changes in the child's behavior because they're being spoken to in a way they can comprehend. And they want to understand and they want to also be successful. And that is a win-win for interactions. Another we see is processing speed. Very commonly, when children with autism have a neuropsychological assessment, and parents might be really familiar with this, it's commonly found that their processing speed is much slower. So you could see I have some scores are higher in some areas, but the way that they process, especially verbal language, commonly takes them much more time. Again, even if they're verbal. And so what we do is as we get to know kids, we start to count in our heads or on our fingers. If I make a request or share information, I will count my head like 1, 2, 3, 4, 5 to slow it down to make sure they actually understand. And do you want me to continue with my list or should I stop?
Yeah, no.
Okay.
Go right ahead.
Yeah, okay. So the other is, it's common, and again, each of this would has to be individualized, is that people with autism, their visual perceptual skills can be a strength. Not always, but commonly. So
absolutely.
And their verbal processing is a challenge. So what we support is that more visual supports are provided in a way that are effective for that person to understand expectations. And so we use really simple things. And commonly people think, it can't work if it's too simple. So we try to really support families and providers to say, no, really, try it and see. So one of the things that we do is we have clipboards in every room, just paper and a clipboard or pad of paper and a pencil and a pen. That's all you need. Is that often we create a very simple schedule, whether it's drawing, stick figures, or putting the words that make a schedule for what's expected. Even sometimes when a child's really upset, if you write down what they say or draw a picture, they then know you hear them and they are more able and willing to engage in a problem-solving interaction. So using more supports, especially visual supports, using less verbal language. So one of the strategies I use a lot and talk a lot about is the stress cycle. So when someone is stressed, and we use the scale of 1 to 5 of escalation and then 5 to back to 1 for recovery and calm. But when you're at a 4 or 5, and that will look differently for each person, your frontal lobe, your ability to process language is offline. So this is the time to be using visual supports or just keeping the person safe and not thinking you're having a conversation. That's also a strategy that safety and love is when they're getting really dysregulated. But the visual and verbal strategies are to be used preemptive to the escalation of the behavior. The other areas that we see is a lot of children with autism have what we call motor planning or executive function challenges. So they don't understand the sequence of how to do something, even if they've done it many, many times. And it's just a part of their brain is not functioning effectively. So, you've showed them one day, how to clean the table or how to get dressed or something around how they're managing their belongings at home. And then the next time, you think they should be able to do it. And for some people, this is really difficult because their brain has a hard time really remembering how to execute, how to perform that task. And so we provide a lot of information around helping understand each child and each adult's profile, the way they process information and the way they need supports to be successful. Like, we use our bodies to live in this world. So how do we understand? So even though physically they could do something, they have a hard time, we call motor planning, having an idea and then using their body to plan that idea and execute. The other piece is that we really try to focus on the why of the behavior versus always, extinguish a behavior. How do you understand the function or purpose of it so that you can really develop strategies that help direct their intent? Why are they so upset? The other is a lot of youth with autism have medical issues. They'll have gastrointestinal issues, bowel issues that can contribute to their behavior. And it's really important that they have evaluations to understand what's happening medically for them. We commonly see kids who have not had comprehensive hearing and vision exams. And some of the youth might be challenging to evaluate or not follow instructions. So we send them to specific providers who know how to work with kids who need their vision and their hearing evaluated. We've had kids who have had can hear certain sounds, but they can't really always hear speech sounds versus they could, hear music or something. Same with vision. We have a lot of kids who come in and ultimately might need glasses, and that makes a huge difference in their life. So those are some basic things that there's medical issues. And the last one that I want to comment on is common that occupational therapists will focus on is looking at sensory processing issues. And this is part of the diagnostic criteria is that autism is a social communication disorder, but it also children or adults will demonstrate repetitive interests or have a special interest, or they'll demonstrate sensory sensitivities or seeking. And so this is another area it's really important to understand how a sensitivity and or a seeking is present under what conditions and how to get help to address that.
Right. You make so many good points there. You and I have spoken a bit offline about, and you mentioned it here as well, about how essential it is for adults to understand where a child currently is developmentally, and then using that information to communicate with him or her in a way that best serves the child. Can you explain a bit about how a parent determines where their child is developmentally? What is it that you are able to do in an evaluation that gives everybody a solid idea of where that child is?
That's a great question. And it's really confusing because some tests, what they tell you is they tell you on average, where your child falls in terms of the percentile compared to other kids. So they're average, they're above average, they're below average. But that doesn't tell you what developmental level they're at. So that's what's really tricky. And we try to help support providers and family members to understand. So it's really thinking about getting developmental assessments, or how do you translate the information on tests to understand where they're at developmentally. So it's really working with providers and asking them what assessments they're using, and are they going to be able to give them information about what developmental level their child is at.
Mm-hmm. How does a parent, and this is just sort of a side note because I'm thinking as you're telling me this, how does a parent know when they seek these kinds of interventions, how might a parent know if they're at the right place? How do they know if they've found a center or a practice that is a good fit for their family?
Oh, that's great. So being an informed consumer is what you're asking
about,
right?
Exactly. Yes, of course.
Well, what I always encourage families to do, and also I also truly appreciate the amount of effort that it takes to manage all of these different providers. It's tremendous. And one is to find out what experience they have with, the age of your family member and a particular diagnosis and interviewing them. And so one is their knowledge, but the other key thing for me is how they work, their style, and what's their passion about for the work, and also how respectful they are within their interactions. And I think both having the content and the knowledge is important, but also figure out if someone is a good match for your family.
Yes, absolutely. Of course, every child's needs are so unique. And I'm always fascinated to hear about things that work for different families. Sometimes a strategy that works really well for one family may not work very well for another, and vice versa. Could you share some examples of interventions that you have tried with families where it really worked well for a child, and maybe situations where you've had to find creative solutions to different issues, different challenges that a child might be facing?
So that's a good challenge. Yeah. So as an occupational therapist, I am really interested in how kids and families function and interact together. So when you work in an outpatient clinic, you're limited by the environment. And so I wish to be able to see children in their home environment or community or school. And I've worked in all these different environments in previous jobs. So what we try to do in an outpatient clinic is try to recreate, to some degree, what are the things that families are typically dealing with, or some activities that are things that families can do at home. And so the first thing is, in my sessions, the family members are in the sessions. They're not in the waiting room waiting for me to take the child and do something in the room and then bring them back and explain it. I honestly don't know how I would learn something if I was not part of that learning process as a parent.
Yeah.
And also because I have 1 hour a week and the child is with the family for all the rest of their life,
all the other hours,
except at school, I'm trying to figure out with them together, how can I be of help? There's things that I know I can develop and do with the child, but if my role in this setting is to be supporting the families, especially when there is a lot of behavioral dysregulation, a lot is having to do with how activities are designed, how the interactions are being navigated. And so that I can better do with the family members in my sessions. It's a different challenge to sort of make sure all that is flowing, but those are ways that I find I can make much more of a difference. The other is we design the clinic to have observation rooms. And so if the parent isn't in the room, they can observe from a window, and then we can debrief and I can explain, when I did this, I was doing it because, and when you do it. And also the way I do something is going to be different than everybody else. And the same with parents. Sometimes I'll have both parents in the room and I'll say, Dad, I had a young man, a little boy that I was seeing who had significant feeding issues. And this is a recent one. And the mom and the dad would come, and the older brother with autism also came to the sessions. And this is a 4-year-old who was also born premature. So feeding issues were really significant. He has severe sensitivity to textures, to the point where if he had any pureed food with a lump in it, he would gag and vomit. And so they were using a syringe to feed him. This was about a year ago. I started with him. He was 4.5 years old. And I was telling them some techniques to do, and we weren't really making progress. So I said, why don't you bring in everything, the food, the tools. Let's try to recreate how you feed your child here in the clinic. And when they brought him in, they showed me that they had to essentially restrain him and hold him down to insert this syringe to feed him. So I was like, okay, this is really important. So what I did is I spent the time helping them figure out how to change the interaction with this child, so that at this point now, we've gotten to the point where he will now sit in a chair and take the food from a spoon. And I wouldn't have known that had they not shown me what it actually looked like for them to do. And that's a fascinating story, because so we have really severe sensitivity to touch and smell. both his olfactory smell system, his olfactory system, and his taste system. And this is a common issue, is feeding issues are very common with kids with autism. And so we were able to work together as a team. And the way dad fed him was different than the way that mom fed him. And it was no right or wrong. It's like, well, how can I help dad? I had them take pictures of where they sat and how they did it. So I could say, well, why don't you try this? And with mom, why don't you try this? And, so that they each could be successful in their own way.
Yeah, that's great. So it really is a matter of sort of immersing yourself in one's family life as much as you can in a successful intervention. That's amazing.
Yeah, absolutely. And when kids are active in seeking sensations, what are they seeking to help regulate them? And that's a common issue too. So we have a small gym in our clinic with swings and bean bags and blankets. And so we'll try different strategies together so that I can evaluate the child from my perspective. And then the parents are showing me what they're doing. And then we can then come to an agreement. Okay, let's try this at home and let me know next week how it went. But they have an opportunity to practice with me or to brainstorm, and I can tell them what my thinking is. They can tell me what their thinking is, because we're both coming with lots of experiences, but from different perspectives that we can hopefully come together and make a plan.
Right. And how does a child's school factor into all of this? Because, and I don't know if you have much experience working with children in the school environment, but I'd be curious to know, when you find strategies that are working with parents, how important is it to get the school involved in these strategies as well? Because it may be that the child is spending their majority of their day somewhere else, in fact, other than in the parent's care.
Yeah, I have worked in public schools, and so I am familiar with that environment, and each school system is different. And I think one of the things that, as an occupational therapist, I think about the environment. So I used to, when I worked in the school systems, would hear parents say, the child does this at home, and then the teacher would say, but they don't do it at school, or the other way around. The parents are like, he's fine at home. And then the teacher's saying, but he's doing this at school. And I would say, oh, that's awesome. That's really great. So what can we learn about the school and the home environment that are either more challenging for the child or are making it easier? There's some kids who the structure of school, they work really hard. They hold it together. They follow the routine, and then they go home and they let it all loose. And then that afternoon time is particularly difficult. And so how to create transitions and routines for that transition from school to home is a really important process. One of the things too, for those children who may be taking medication, we talk to our psychiatrists that are treating them and say, what do you think? And there are times that medication is adjusted, so there's an afternoon dose that helps with that transition. And again, that's under the guidance of a child psychiatrist, but that can make a big difference for families and their lives and for the child, because when they feel out of control, they're not feeling good about themselves, as is the case for the families. But back to your question about, how to carry out, having communication systems with school is really vital. And each school or teacher does that a little differently. But there should be a way that the parents can send notes to the teacher and the teachers can send notes back to the family in a timely way. A lot of teachers now use email, and that depends again on the school, but to have more effective communication. And also what I think is important is that not all environments and activities are the same. So when thinking about school, children do well in many ways, and then there's certain areas that are more difficult. Sometimes we find that the expectation for children to participate in what they call the specials, which are less structured activities, can be the most challenging for exactly that reason. There's less structured and less adult support. So one of the things that I always advocate when I worked in schools and when I work with families or I work with providers is that the children need support. When they go to recess, who's helping them figure out how to play with the other kids? This is a great opportunity. When they go to, the large auditorium events, it could be really overwhelming if they have sensory sensitivities. If the sound is too much for them, are they wearing headphones? Are you previewing and getting them ready to know what to expect? There's a lot of strategies to help kids be successful in these less structured activities. We, in some ways, expect more of them without the right amount of support. They do well when they're structured, so why not when they're in these other specials getting the right supports. More isn't better if it isn't the right support. That's a really important concept as well. So I think it's collaborating with the teachers to know when is the child doing well and when are they needing support and what are those strategies that they're using. And then sharing what are the things that you find successful at home with the teachers and vice versa when things are difficult. So there is a consistency between some of the strategies, but that it's also the strategies match the environment and the people who are in those.
I like what you mentioned about the specials. And for those of you listening who may be in other states, I'm assuming what you mean by specials are, the extra stuff like music class, art class, physical education, anything that's not taking place within the typical classroom environment. Am I right?
That's exactly right.
Yes, exactly. And so I would like to, I just was thinking it's probably something that parents can, these strategies for specials, it's probably something that parents can work into their child's IEP or 504 plan.
Absolutely. One thing that I love to advocate for is adaptive physical education. So that's a wonderful way to ask for an evaluation, because I've also been part of running studies for kids with autism. And one of the sections that we would administer would be the gross motor section. So what's interesting is that given that with autism, there's a social communication, there's a language comprehension, and also many kids have cognitive challenges. So if they're given an instruction and they have a hard time understanding it, but they physically can do the activity, but then when we would do the test, they would score low because they couldn't comply with the instruction. It doesn't mean they physically couldn't do the activity, but they didn't understand the instruction.
Oh.
So what's really important is that when they go to, and in this case, gym, are they getting the supports to help them understand the instructions and to be successfully participating in the activities? They need to move and develop their bodies just as much as everybody else and needing the support. So I love referring to my colleagues in adaptive physical education who are trained exactly to do this. And the kids love it. I mean, often kids will refuse to go to gym because they're not getting the help they need. Sometimes it's the room's too noisy, but in addition to that, everything's moving so fast and they can't comprehend what's happening. It's overwhelming. And then they have a meltdown. And what we end up doing is focusing on the symptoms, the behaviors versus the cause.
Wow. So do you find that schools are generally receptive to those accommodations in classes like gym?
It varies, to be honest, on the school system and the resources that they have and the type of physical education teachers they have. So I think in general, schools want to do the right thing, but a lot depends on the resources and the support they have to do their jobs. But what I would love to see is the continued effort for families and school staff to be able to communicate more fluidly. And I know it's challenging, but I think it would be a win-win if there are ways that could be developed and supported more.
Absolutely. Do you have any strategies for how parents can communicate with the school in a more effective way? I know you mentioned email as one. Have you seen anything else that works particularly well in these situations?
Well, one of the things that help is that parents are entitled to observe their children at school. And so working with the school in a supportive way to say, I would love to come visit my child for the day. Can we make a plan that is both respectful of the work that the teacher needs to get done, but also that I can have an opportunity to see how my child is doing, and to also support seeing the child when they're doing well and wanting to observe at the times they might have more challenges. Again, because when you're not there, it's hard to appreciate all the factors. And so parents are entitled to observe their child at school.
That's great. I love what you said about seeing their child's successes, because that's just as important. We forget about that sometimes, don't we? Like we want to know, what's challenging so that we can fix it. But it's wonderful to see where your child is thriving as well.
Yeah. And it's an opportunity for when the child comes home, the parents can just be reflecting back about, how wonderful it was to see them during math class and how they were able to, solve some problem or, whatever it is, like starting with reflecting back to them. Again, that's going to build their self-esteem and also gives them accurate feedback. Oh, I did do well. Oh, I do understand how to do this. And to be able to then generalize that approach to the areas that are challenging. Often I feel like we have such high expectations, and not that we don't want to have high expectations for them, but we want to have the right expectations for them so that they can be successful.
Absolutely. We talked a little bit about visual supports and also about one's developmental level. How might visual supports change as a child's developmental level increases? I know I'm aware of various different types of visual supports, but how do you ensure that the visual supports, which are so important, are changing and evolving with the child?
That's a great question. I mean, in Can-Do and actually wherever I have practiced, I have worked closely with speech and language pathologists. A surgeon has to work with an anesthesiologist. I don't know how I can do my job without a speech and language pathologist. And again, autism is a social communication disorder. And so I rely on my speech and language colleagues to help me understand the language level, the language strategies that are effective, and how we collaborate based and integrate, my goals as well. So one is making sure the child's getting regular assessments and getting treatment from a speech language pathologist, and then also getting neuropsychological testing when it's appropriate for somebody. And through that, it's really understanding at first, are they processing and most competent with understanding information that is a photo? And actually before that, it's the object. So developmentally, kids identify an object and then they match. These are two trains. This is a train. And this is a cup, and these belong into the feeding category. And so it's just, helping them understand physically what an object is and what it means. And then how is that represented in a picture? And then typically it's to some sort of drawing, and then it ends up with letters, and letters have a meaning. And so it's really important to understand which level of visual processing is that person at with these means of comprehending information.
And you mentioned it being especially challenging with children who are verbal, because people may assume that they're at a higher developmental level than where they really are functioning. And so maybe it's the case that a child may be able to read the words in the visual support, but that's not actually the part that they're processing.
That's exactly right. And that's a common trajectory, is children with autism have challenges with what they call narrative development. How do they understand the story? And again, this involves perspective taking, it's a key challenge for people with autism. If I'm telling a story, I have to understand different perspectives of the people in the story and how their perspectives are connected. So I think that's because we evaluated a child just a couple of weeks ago who was 12 years old, had some more expressive, he could say the words that were closer to his age, but what he actually understood when Sue did the testing was at a 5-year level. But you wouldn't really see that necessarily when you would see the child. You think, oh, they sound like they understand more. But when the testing was administered, he was really at a much younger level. And we see those kinds of splits between expressive and language comprehension all the time. It's a common issue.
Absolutely. So it's very important for parents to make sure they're getting the right support. Well, you guys are doing a fantastic job of that. Thank you so much, Mary Beth, for coming on the show today. I know I've really enjoyed getting your perspective, and I know you've given our families a lot to think about. So thank you so much.
You're welcome. Thank you for inviting me.
My pleasure. To our listeners, if you have a Torchlight account and you'd like to know more about this topic, I suggest that you log in, visit the webinars page, and listen to the on-demand webinar called Autism Spectrum Disorder, Latest Research and Treatment, where you will hear more of Mary Beth and all of her fabulous suggestions. If you're raising a teen with autism, you should go back, if you'd like, and listen to the podcast episode found here called Autism and Adolescence, Navigating the Teen and Tween Years. Well, everybody, that is all the time we have for now. Thank you so much for spending a part of your day with us, and we will see you next time.
Thanks for listening to Torchlight's Exceptional Parenting Podcast. Find this and other episodes on iTunes, Spreaker, and Podcast Go. If you're interested in bringing Torchlight Child or any of Torchlight's other caregiving products to your workplace, please contact info@torchlight.care. That's info@torchlight.care.